Welcome to Harlow on Healthcare. I'm David Harlow, and I invite you to join me by my virtual hearth as I sit down with healthcare leaders to discuss building the future of healthcare. Today, my guest is Curt Medeiros, President and Chief Operating Officer at OnTrak. OnTrak is an AI and telehealth-enabled virtualized outpatient healthcare treatment company focused on improving general health by dealing with behavioral health issues. Curt, welcome, and thank you for joining us today.
Thank you so much, David.
I would like to ask you briefly to tell us a little bit more about OnTrak and what problem you are working to solve.
Absolutely. Thank you so much. So part of the reason why I joined OnTrak was our ability to identify, engage, and then drive into appropriate treatment people with unaddressed behavioral healthcare conditions. Today, we focus primarily on individuals that also have high medical costs, but I'm very excited to take the technology and analytics approaches that we've developed and really try to help behavioral healthcare much more broadly.
So right now, I mean, we're speaking in the midst of the COVID-19 pandemic, and there have been so many aspects of healthcare that have been put on hold in a way. I and others, plenty of others, expect that we will see that the things that we haven't been looking at are going to explode into larger problems once we're able to step back. And I think some folks have already started to see that in terms of deferred screenings, deferred attention for other sorts of issues. Do you see that in your world, and how is that playing out from your perspective?
Absolutely. But if you give me, I just wanted to go back a minute and talk about, we are in a crisis because of COVID, but we have been for quite some time. And that's part of the challenge in behavioral health care. So if you look at even before the pandemic, there were more than a quarter of the US population was dealing with the effects of some form of behavioral health condition, but less than half were receiving the type of care that they need. That's a challenge. This means that over 80 million people out there are suffering, and somewhere around 40 million were not getting adequate care. This is a big challenge. Now, when we think about COVID coming into the picture, which has brought isolation, new sources of stress, whether it's unemployment or now parents that have children at home that have to think about how to do online school but still be able to manage work, not being able to access the same daycare that they used to have. And then the isolation with not being able to visit or take care of family members, whether they're elderly or ill, that need your help. This has created a big challenge and a whole new level of stress, and we see this broadly. This is not just someone that has had behavioral health conditions before. These are now mothers and fathers, your next door neighbor. And one of the things that we've seen is frontline workers, particularly in the medical profession, dealing with heightened levels of anxiety and depression because of this situation. McKinsey estimates that the prevalence of BH conditions could rise by up to 50%.
Yeah, I was just going to ask.
Please.
You're talking about like a baseline of folks with behavioral health issues and sort of unaddressed issues, but it sounds like you're talking about much greater numbers given current conditions.
Absolutely. So before, it was about 80 million individuals overall, and about half of that not receiving adequate care. Now, with this increase in prevalence of up to 50%, we're talking about an additional 35 to 40 million people who now have to figure out how to navigate the behavioral healthcare system. This is a huge influx to a system that was already challenged. This means that 1 in 3 Americans need this type of help. And if the only thing that we do in this conversation, David, is talk about the challenge with access and driving to appropriate care, I will be happy. But I do look forward to talking about some of the technical aspects as well.
Sure. So yeah, briefly just on the access issue. I mean, it's both supply of behavioral health professionals and it's a coverage issue, both in terms of plan design and in terms of folks falling out of coverage given the epidemic of unemployment in our current situation. So in either event, there's there's a cost issue and there's a supply issue, so to speak. Does your company address either or both of these in some way?
Yeah, so we are really focused on identifying the individuals that have unaddressed behavioral health care conditions, whether they have showed up in the behavioral health system in the past or not. And so we partner with our health plan partners, leveraging their data to do two different things. One is if people are already diagnosed with a condition but aren't getting the help that they need, we can identify those individuals. The other part is leveraging some of our proprietary analytics to identify individuals who are highly likely to have a behavioral health condition but have not showed up in the health plan's data or in the behavioral health system before. And why is this important? Well, again, we're adding 35 to 40 million new people that haven't had to access or navigate the system before. And this is not just costly, but it's also a challenge. And so part of what we're trying to do is identify those individuals, get them into the appropriate care with our health plan partners, so that way they can start the journey. And why is this important to the healthcare system? Why is this important to your listeners? Well, one, in addition to the ethics of not wanting people to suffer with behavioral health conditions that are getting worse with everything that's going on in our world, people with these conditions that have not sought the appropriate care, have not received the appropriate care, are actually 4 to 5 times more expensive in their overall healthcare costs than folks without the behavioral conditions. Again, going back to that Milliman study, about 27% of the overall population has a behavioral health condition, and they accounted for, even though they were 27% of the people, they accounted for about 56% of the overall cost. If you look at the highest cost population, so this highest cost 10% of the population, which accounted for about 70% of overall healthcare spending, within that, folks with behavioral health conditions accounted for almost 6%, so about 5.7%. But they drove 44% of the cost. So what does this mean in practical terms? For 6 people out of every 100, they're spending, the health plans or out of pocket is spending $44. For the remaining 94 people out of 100, they're only getting about 70 cents, just above 70 cents. Now, if I'm a health plan, if I'm a participant in the behavioral health system, I want to find these people so we can get ahead of that, so we can balance this and make sure they're getting the help they need before they get into those high cost groups and end up spending even more money to address their overall physical and mental well-being.
Sure. So, Curt, without getting into your secret sauce, how do you reach out and figure out who are these people who are likely to benefit from interventions? What are some of the signals or markers that can key you in to understanding who needs these services?
That's a great question. And so I wanted to just set a little context before I dive into the details, if that's okay.
Sure.
When I look across the use of advanced analytics, particularly artificial intelligence type of methods in healthcare today, there's sort of 4 big buckets of how people are using these methods in healthcare data to try to improve the system. The first is actually trying to leverage data to improve administrative process efficiency. This is by far, at least in today's world, the biggest use that is actually in application in healthcare. But part of the challenge is, as you mentioned, David, this does not help the folks that we're trying to identify in the behavioral healthcare system with needs. Second, third, and fourth are things that can be done to help these individuals. So number two, identification and targeting of unique groups. And I described a pretty unique group earlier, and I'll come back to that. Third, customizing engagement, whether it's the channel in which is communicated or how you interact with those individuals to try to bring them along their journey to try to establish trust and then get them to the healthcare that they need. And then fourth, determining and recommending care pathways. And this fourth one, whether it's on the medical side of healthcare or on the behavioral side of healthcare, is really not that well developed because the data necessarily, particularly in the behavioral side, to demonstrate success after choosing a particular care pathway is just not ubiquitous today. So to Ontrack, we focused in on number 2 and 3, the identification and targeting, and then the customization of the engagement process. And so I can give you a couple examples of how we do that. We've worked with our clients to leverage their data, predominantly claims, to not only identify folks with existing diagnoses, like I said, but also to predict those who might have an undiagnosed behavioral health condition. And why is that important? Well, there's 2 reasons. One is, even if someone has a history of behavioral health needs, if they switch employers, which as we know right now is happening a lot, or losing their jobs, which causes them to switch health plans, that data tends to be lost. Because as we know, the health plans are not broadly sharing data across the different organizations. And so being able to identify those individuals through our predictive algorithms is important. And then second, we talked about the people that are net new to the system. Again, the 35 to 40 million people that will be entering the behavioral health care system in the coming years. They have no historical data to go off of. So we need to be able to look at other patterns in their data to be able to understand, are they highly likely to also have a behavioral health condition? So how do we do this? Today we have already, and we've been doing this for years, leverage artificial intelligence methods, whether it's machine learning or neural network type of approaches, to be able to scan through a member's history. And we look at things like comorbid conditions. Do they have cardiovascular disease, metabolic disease, and other things? The utilization patterns of, again, their history. So where are they interacting with the healthcare system, inpatient, outpatient, emergency room visits, and for what purpose, are really important factors in this puzzle. Their prescription history, which gives us an indication of what are they taking, for what reason, and what might have they stopped taking and why. And then lastly, different demographic factors on the individual. And what this allows us to do is, when we look across the history of these different factors, and we look at more than 20 different factors, allows us to predict, based on historical patterns, with more than 90% accuracy, someone who is likely to have a behavioral health condition. And then we can see, have they received any care? Have they received any behavioral health care for those conditions? When was it, and why? What this allows us to do is actually target, depending on the health plan, depending on the client, an additional 25 to 30% of individuals on average that we wouldn't find that with a previous diagnosis history. So this allows us to go after those new people, or goes after those folks that need care but have switched health plans and haven't yet come back into the system.
If you're just tuning in, this is Harlow on Healthcare, coming to you on Healthcare Now Radio. I'm David Harlow, and my guest today is Curt Medeiros, President and COO at OnTrak. Kurt, so what you're describing is sort of an interesting use of AI and mining data. And I imagine this is data that you're able to access through a health plan client of yours who has folks in their patient population that they're responsible for. Tell me a little bit more about how you connect with the health plans, what kind of data they have that's available to you, particularly in the circumstance that you just described where someone has switched health plans in the past year, let's say, as we often do in this country. And how are you able to access information that allows you to make these predictions?
That's a great question. Our relationships with our health plan partners, we're organized as business associates, so we're allowed to work collaboratively in their data, which is a mix of eligibility information. So it talks about when someone has eligible benefits on the medical side, on the behavioral side, and when did they come into those plans, and also when might they have left if they are no longer in that plan. Second is a diagnosis history, and this comes on predominantly on the medical side, but also in certain circumstances, we can look directly at codes associated with behavioral diagnoses. And then third is again that utilization and claims history. So what services have been accessed where in the healthcare system, for what reason, and at what cost. And what we do is we look across all of this different data to understand patterns that are associated with substance use disorder, anxiety, or depression. And what we find is in looking at these examples that many of the members that we identify actually have multiple behavioral health conditions in addition to multiple chronic conditions that they're dealing with. So a very complex population that is high cost, and it allows us to pinpoint who needs access to these services the most.
So are you using those three areas as sort of signal indicators, so to speak, and that then allows you to key in to who needs attention, and maybe then they need attention on other fronts as well?
Absolutely. So, when this all started, and this was long before I joined the company, but was a big part of what was exciting to me about what had been built, is looking at historical analyses. The team was able to correlate different patterns, leveraging the tool set with definitive diagnoses in the SUD, anxiety, and depression populations. What then it allows us to do is when we get the next batch of data on new populations, it allows us to predict based on those same patterns who is highly likely to have the same condition, even if the definitive diagnosis code is not there. That then sets up our engagement process. And this is another area where we have used advanced analytics to customize our process and continuously learn how do we engage. So as you could imagine, if we are reaching out to an individual for the first time who we believe needs help, if we picked up the phone and said, hello, we've combed through all your data and we think you need help with substance use, that's a conversation that probably would not last very long. So what we've learned in literally hundreds of thousands of hours of conversations with people that have substance use disorder, anxiety, or depression, or all three, is being able to understand what is going on in that individual's life, get them to focus on one or two areas that they want to start to make a positive change, and understand those deeply and give them a path to set short-term goals that lead them on that path is the way to get them to take the first step. All we need is that first step, and to help drive them along hitting those short-term objectives that then allow us to address the underlying behavioral health condition, even if it's not something that they shared in the first few conversations. And that's really important to not only our program, but getting them into the behavioral provider system where they can get access to the therapists or psychiatrists or social workers that they need help from longer term.
So I'm sure the plans love you for identifying diagnoses that weren't in their records already for a variety of reasons. And then it sounds like you're providing some services or counseling services directly or through affiliated providers. And then also there's some sort of handoff to other behavioral health providers. So I'd like to ask you a couple of questions. One is, what are your metrics in terms of engaging with plans? Do you speak in terms of how many covered lives are you contracted for, or what sort of universe of plans are you contracted for? And then how are these services being delivered? Once you do the analytics up front, who is delivering the behavioral health services to the patients?
Great question. Thanks, David. So on the first part, we tend to talk about our active outreach pool, which in our speak means the pool of individuals that are not only eligible for the Ontrack program, but also fit the specific clinical and behavioral criteria to enter the program. So we take millions of individuals from our health plan data sets, apply the predictive models and clinical and behavioral filters to get to this outreach pool. And at this point, we're talking well over 100,000 people. Now, just to put that into context, if you remember the earlier part of the conversation, we are looking initially at that high cost group. So it is somewhere between 3 to 5% of our health plan partners' population that we're focusing on, because we want to go after the folks where we can not only get them access to the right care, but by doing so, help drive down their medical costs. So then on the second part of your question, in terms of the process and what does Ontrack do and how do we drive appropriate care? The first piece is once they enroll in the program, the individual is set up with a care coach. And the program can be up to 12 months long based on the individual member's needs. What that means is this care coach becomes the concierge or the quarterback to understanding the member. Earlier, we talked about being very deep in understanding not only the member's issues, but also what more broadly is going on in their lives. And we see many of these people not only have challenges in understanding, do I actually have behavioral health benefits? How do I access the right care? But also have significant challenges at times with social determinants of health. Do they have a stable living environment? Do they have access to transportation or healthy food? So the care coach becomes the quarterback in helping address some of their needs that remove barriers to getting into the behavioral health care. And it might start as simply as, being able to deal with situations in their home with their family. All of our work is designed to move from that initial set of goals to get the member to admit and begin to trust the care coach so that they can talk about their underlying behavioral health condition, whether that's substance use, anxiety, or depression, or a combination of those three. And then we work with them to get them comfortable and actually become the navigator into the behavioral health care system. So depending on what they need, we will match them up with the appropriate therapist, psychiatrist, or in some cases both, and help them continue on their care path in parallel. So the coach will stay with the member as they continue to access the care they need in the behavioral health system. And this is a contracted network of providers we work with, over 12,000 across the United States today. And again, this will last up to 12 months with the objectives of having documented changes in being able to manage behaviors differently, accessing the behavioral health care system on a continued basis, and reconnecting if they are not connected with their PCP, because that is the means by which they get the rest of their chronic conditions on the medical side under control.
Well, Curt, to wrap things up, let me ask you as my final question, if you were to wake up tomorrow and find yourself 5 years in the future, what's one thing in healthcare that you would hope or maybe even expect to find has changed dramatically?
Oh, I was waiting for this question, and I think probably like most guests, you can't always narrow it down to one thing, but I would say that at the highest level, if I had to pick one theme, is that we have made major strides in leveraging technology in behavioral health care. So what does this mean? And I often like to challenge my team with saying, if we were designing something new, how would Apple design it? Or how would Amazon design it? So think about this. If your Amazon experience was you need to show up at a random location, fill out a bunch of forms, even if you filled them out the last time you were here, wait an unspecified amount of time. When you actually get into the service, the person delivering it probably has forgotten who you are, and then you're not exactly sure what they're talking about when you're there or what the issues are. And then on top of that, if you want to get anything else done, Amazon will send you to 3 other locations. And then to top it off, weeks later, you get 5 different documents in the mail, in the snail mail, that all look like bills, but really only 2 of them are bills, and the rest are just confusing. So what I think about, we have an opportunity in behavioral healthcare to really streamline that by using technology. Having consumer-facing applications that collect data before the member even enters the system. Analytics that will help determine the best care pathway and match them to a provider, preferably over telehealth, so they can initiate and continue their visits when it's convenient for them in the privacy of their own home. Upon acceptance of that provider, data gets shared, the care pathway is uploaded to that individual's app, and we can track progress. And then last, key stakeholders, including the member themselves, can have visibility to progress along that care pathway as well as the outcomes that they achieve. And I know that requires a lot of different things to come together, David, but that is really restructuring, leveraging technology is what I hope for in the next 5 years.
Well, that's a positive vision and something worth striving for. Thank you, Curt, for joining us.
Thank you so much.
You have been listening to Harlow on Healthcare. Join us at healthcarenowradio.com. Let's continue the conversation on building the future of healthcare together at #HarlowOnHC. I'm David Harlow, keeping the fire going and holding a seat open for you. Until next time.